Good evening. Welcome. Hello. Thank you so much for joining us. Thank you for joining us for episode 5 of Dr. Jeff Talks About Sex and Intimacy, Mastering the Vacuum Erection Device. You can catch us on social media, all these different outlets. Don't forget Facebook, YouTube. You can watch us now. You can watch us live. You can watch us later. We're happy any way that this comes to you. We really appreciate you being here, whether you're here live or whether you are joining us later with the recording. Thank you for taking the time to learn this. Tonight is the night. You can visit our website anytime. The calendar is in there. And when you visit the website, you'll see all the upcoming programming with amazing guests. So don't forget to look there and find us there. Also, while you're in your car, you can listen to us on Spotify, Podcast, Amazon Music, and iHeart. So we're there now. So if you want to listen to us while you're on the road, please do. This episode in particular is on the vacuum erection device. So if you are interested in learning all the keys to success with that, we're going to try to come up and go over every single thing we can to help you with that. It's going to be a great show this evening. Again, the goal of the show is simple. It's just to enlighten and inform you with evidence-based information to improve your sexual health, to deepen intimacy, and to improve your relationship with your partner. So we are going to jump in and talk about this device. So if this is not of great interest to you, this is a device that is used for erectile dysfunction. Remember, 1 in 5 men in their lifetime will have erectile dysfunction, and it can be very frustrating and upsetting to men. This one in particular is to highlight one of several treatments that are available and FDA-approved. This is a medical device that has been approved and has been around since the 1980s, and it does have a 90% success rate. We have worked with men, myself and our guest this evening, Kathy Marchese, my good friend. Both have worked with thousands of patients with the vacuum pump. Literally thousands of patients. And we have found there are some things that help you to be really successful. So we'd like to jump in with our slides and go over what we have. We're going to go back and forth between slides and explaining things and showing you the vacuum pump. So tonight, here we go. If you wanted to ever know anything about the vacuum pump, this is your time and place. There's good and bad with everything. This is really important. When you come into our office, what you really want is you think it, and with the least provocation, there your erections are, just like they were when everything was perfectly fine with erections. We understand that that is what you really want. And I promise you, if we could give you that, trust me, I would give you every bit of it, and I would give it to everybody who walked to my clinic, because you deserve that, and that would be wonderful. But the truth is, we have to work with the things we have, and every single one of these treatments have positives and negatives, good and bad. So this one does too. What you really want and need is you think it, there it is, and you don't have to mess with the vacuum pump. You don't have to do all this. If I could give you that, I would. But even the pills take timing, take different things. And we're going to talk about the pills a little bit tonight, because you can use those along with your vacuum pump, and we'll say why you might want to do that and why that might be helpful. But we'll get to that. So the vacuum pump offers something that's completely non-invasive. That's first and foremost. You're not putting anything into your body, and it has a good 90% success rate. And I will tell you, I've probably met about 3 men out of all the men I've worked with, and I told you it's probably about 1,000, who we couldn't get this to work properly for, with the proper instruction, patience, and practice. Would you agree, Kathy?
100%. Patience and practice are the most important thing with using the device.
But it works for pretty much everybody if they're willing to use it. And it's far from perfect. We're not saying that, but it does work for most men if you practice and are patient with it. The keys to success we kind of highlighted already. Have we said that enough? Practice and patience. And we're going to say it again, I promise you, before we're done, because it's so incredibly important for your success with this device. and also helping you integrate it into your love play with your partner and the sex and intimacy that you're trying to have with the partner. So, but it is important to find a good medical grade pump. Now, I have had people find pumps at different places. You can find them at places, different places, Lion's Den, Lover's Lane, all those kinds of places as well. And some of those pumps can be perfectly fine. The medical grade pumps have to meet a certain medical grade standard. And so that's typically what we recommend. And you can get very reasonably priced medical grade pumps. And we'll tell you a little bit about some of those as we move through this evening.
I think, and the important thing you want to add too is that these are safe. So they give you a certain amount of pressure. It's not going to do anything to pull like too much blood down into the penis so that there would be any creation of danger. So it's not going to make it too strong. You're not going to damage yourself. You're not going to have any injuries.
So if you're careful and you use our guides, because the minute you feel pain, you're going to do a release. You're going to release the suction. We're going to teach you what that is. So if you follow the guidelines and you work carefully with it, yes, you could hurt yourself if you did some really strange things, but if you do it properly and you work with it carefully and patiently, it's a very safe device, and most people do perfectly fine with it. There is a manual version where you pump, and I'll show you actually later. You hand pump. The pump happens some way like that with your hand, and there's a battery operated version where you push a button rather than pump. They do the same thing. They both create a suction that forces more blood in your penis, and I'll show you more with that in just a few minutes. Manual or battery operated, and we'll talk about why you might choose one or the other, or one versus the other. But there's also an option with some kits that you can get both, right?
Right.
So there are different companies that will offer affordable that you could have the manual and the battery one all in one kit, and pretty reasonably priced too. So let's talk a little bit about barriers to success. Kathy would like to share some of her thoughts about that with you.
So one of the reasons why a lot of men will turn away from it is because they'll experience the discomfort as they're inflating. And typically that's because they're pumping it up too fast, especially with the battery operated one. You literally want to turn the suction on for like 2 seconds and then stop. And then wait a minute, 2 minutes, 3 minutes, whatever, because what you're going to see is that the base of the penis is going to get significantly larger. And so then you need to wait a little bit and allow that blood to shift on down the full length of the penis. And then you just do it a couple seconds more. I think there's probably less of that sudden inflation when you're using the hand pump. Don't you agree, Jeff?
Definitely, because I think, but I have seen people pump profusely and it's not good either.
Right.
But when you have the device, and I'll show it to you better later, but when you have the device, this is the manual device that pumps. So here's the cylinder and here's the pump. And when you pump, it creates a suction, and that suction is going to force more blood in your penis and make it harder. So you're pumping with this against your body and your penis inside, but you can also with the battery, you'll just, instead of this, you'll push a button. So what Kathy's saying is we'll teach you, but once your penis is inside and it's against your body, you push the button for a couple seconds and then you release, holding it against your body, holding the suction, but not holding the forcing more blood in. So you push 1, 2, 3, and you release 1, 2, 3, 4, 5. I usually have people release for 5 counts to allow the blood to move across the penis down to the tip, to move across it, down it, to the head of the penis. So that's what she's referring to. We can go back to the slides.
And so then the other thing that we worry about is if you do pump it up too fast or you don't have it in the correct position, you can actually pull some of the scrotal tissue or some of the testicle into it. Yeah, you'll do that once.
That's going to happen once and you will not be doing that again, but immediately hit your release button.
Right. And I'll usually tell the patients that it's important to make sure that they have it firmly pressed against your pelvis so that it doesn't slip away when you're pumping it up, and then that's when it comes in. And I would like you to keep the position of the vacuum device in a downward position.
And I'll show you that a little bit when we demonstrate a little bit later with more of the demonstration parts.
And then in each kit comes a variety of different rings. And so some of the rings will be too large and some of them will be too small. And that's just a matter of practicing too, to see that when you inflate it, does the ring that you're using hold the penis full so that it's not going to be leaking blood out of it? If it does, then you have to go to a smaller one. And sometimes when you're using the smaller one, that's when you can get some discomfort because it's just a little too tight on you. So it's, again, a matter of deciding which of those rings are going to work the best for you.
And we'll talk about rings very specifically when we go through step by step. And I'll tell you, I always have people start with the very biggest ring in their kit and work their way to the one that holds, because a ring on your penis is very strange. It can be uncomfortable, and we want you to get used to it with the very loosest ring in your kit if possible.
Mm-hmm.
But we will talk more about that when we go step by step.
I think that's probably it about the pain that we would expect. Do you have anything else you want to add on that?
I mean, when we get to the demonstration, I'll show you how to release everything about it.
And I think then that the lack of spontaneity is another big issue with this. This is, not like when you would get your normal erections where you had a thought, you had some stimulation, and the erection develops. We know in reality that you're using this device because that's not happening to you. You're not getting spontaneous erections to the rigidity that you want, or they don't last as much. So you have to take a look at this as a step in the right direction. We're going to do something that's going to allow you to be sexually active when you want. It's cumbersome. We understand that. You have to have a little kit that you use. It's not quite like, looking at your partner and then responding well, but it takes time to set up the equipment. You have to find private time to learn how to practice. You don't want other people walking in or, having phone calls or anything like that. And we understand that all these preparations for it, all the practice kind of destroys that moment. But when you get the erection and you're able to have the type of sexual activity you want, it's well worth it. Well worth it. A lot of people are like, I don't really want to have to use this. I want to go back to normal. And sometimes we just can't return you to that. So we just ask you to just kind of open your mind a little bit. It's not going to be your first choice, but it really works well. And sometimes having to use this creates some feelings of resentment, anxiety, embarrassment for needing this. And we understand that that's an issue that you're having. And we hope that by, working with your healthcare provider, you can get over those challenges and then understand the beauty of the product. Manual dexterity. So, a lot of the patient, or a lot of you who are using this device may be in your 60s, your 70s, and your 80s, and you may not have the strength to use the hand pump, which I find is where the battery operated the battery operated option works best for you. If you have medical conditions like Parkinson's or MS, or you've had a stroke, again, that can present a challenge for you. So you just need to work with your healthcare provider and hopefully find something that's going to work well for you. Some of the patients, if they have arthritis, it's really difficult for them to use these. But in 90% of the time, we can find some way that it will work. We can also involve your partners. If you don't have that physical strength to inflate that pump, we can bring your partner in and show them how to do it too. Yeah, I'm good with that.
Okay.
Do you have anything else you want to add?
Did you want to talk about the psychological things, or before we go on, or do you want to talk about it as we go?
Okay, so yeah, well, I guess we could. So psychological, you as a patient know that you're not getting good erections. And so there's this certain part that is saying, this is not natural. I don't feel right about needing this. Some men will have the perception, or even their partners might have the perception, that it's like a sex toy. So there's just something that's just not quite normal about it. I think if you go back and you talk to the person who's working with you, they can help you get over that or give you some suggestions. This is a perfectly natural thing. So imagine like if you had diabetes, needing insulin is not an issue for you. You think, okay, I have a medical condition, insulin is going to treat that condition. We'd like you to think about using the vacuum device as that same thing. It's a form of treatment that is going to allow you to overcome this disease or this medical condition. So some people will think, well, it's not very manly if I have to use something this. I want to just be able to get my own erection. Well, we know that that's not happening. So again, let's take a look at the reality of the situation and understand that this is going to return that level of manhood. You're going to be able to penetrate. And I can tell you, and Jeff can say the same thing, when we use this with our patients and they see the type of erection they get, they are just thrilled to death with it, just thrilled to death. And it really does make a huge difference for them. The other thing that you always want to think is, I always suggest that you prepare your partner in advance, so that you're going to be doing something like this. And as much as we can get them involved in the use of the device with you and understanding why you need it and how it's going to work and how it's going to actually improve their sexual life, that's going to help make it a little bit more comfortable for you.
So let's jump in and talk about start to finish how we do this. So the first thing is to prepare yourself and get ready. You want to either trim the hair. You can trim it a lot of different ways, but you want to trim the hair around the base of the penis. The reason you need to do that is you're going to need to get a good suction seal around that area. And if you have a lot of hair, you're not going to get a good suction seal. It's not going to happen. Trust me, you won't get good suction. But when there's not hair, you do get good suction, and you will definitely have suction when it's against your body and there's not a lot of hair. So that's going to be really important. And so, so trimming the hair to achieve the proper suction seal. And also you don't want the hair to catch with the ring and things like that as well.
Because that hurts when you're taking the ring off. That can really hurt.
Ouch, for real.
Right.
So, but here's the thing. When you shave hair, you can cause like a folliculitis, a dermatitis, different things. The razor can, those little micro abrasions can be places for infection and stuff. So we don't recommend necessarily doing that. In general, it's not recommended to completely shave pubic hair because of those reasons alone, because those little micro abrasions can get infected and hair follicles can. But instead, you can trim the hair. I'm going to come back to this slide.
Let me just add that sometimes I'll have my patients just cut their hair. And they can cut it pretty close to the cuticle there, and it's not going to cause any problems with skin rashes or irritations, and it will allow good suction.
So be careful whatever you're using, because sharp objects near your penis is a frightening thing, okay? Your partner may need to help you, but that's why typically, and absolutely, people can trim. You can trim with a lot of different things. And as Kathy said, some people will trim with scissors. Their partners may help. They may do it themselves. And if you can do that, great. But be careful with a sharp object near your penis. Certainly, be very careful. And then, but I want to show you what's a beard or hair trimmer. Now, if you look at these guards, you see this guard on here, and these guards help trim the hair a certain length. It trims it nice and neat, but it doesn't trim it down to the skin where you could abrade yourself. And it keeps you from nicking yourself for the most part. So you can use a guard. Here's just two examples, but there's one, this is one by Braun and Phillips and Wall. Almost all of those people make these. You can get a hair or a beard trimmer, but you want a guard that will protect you from nicking yourself. So let's go back to the last slide. So you can use one of these to trim the hair neatly if you like. And actually, this is a popular thing. They call it manscaping. All the young guys do it. So, you know, it's not a bad thing to do. A lot of people do it. But getting that hair trimmed neatly can be important. Alternately, you can use a little protective device. You see this hole in the middle, and the penis goes through the hole, And then this covers your hair and skin around the penis. So this is a guard that covers the hair and skin, and it can sometimes help. So your penis is in this hole, and this guard protects the skin and the hair around it, so that it can also sometimes help you from pulling other things in. But I'll tell you, your scrotum can pull through this hole too, so be careful. But this is a guard that you can get. Almost all of the different companies have them. Sometimes they're like a flesh colored, a darker color, or a clear color, but it's a guard to put the penis through, and it covers your hair or your skin.
And it goes on before you apply the suction device.
It goes on first, just like you would trim your hair and have it neat first. You would put your penis through this hole and put this against your body to cover the hair and cover the skin. Okay, hopefully we're making sense so far. So you can use a protective shield to cover the hair, or you can trim it. And again, you could involve your partner in that if you like. Some people, I've had patients who said that was kind of fun. They may do that, whatever. And if you don't feel comfortable with that, that's fine too. So you've got the hair trimmed, you're nice and neat and ready, or you've covered the hair so you don't pull any long hairs into those rings or have pain from that. Lubricant is a really big deal for the vacuum device. Water-soluble, water-based lubricant. Any water-soluble, any water-based lubricant is fine, but a water-based or a water-soluble lubricant. So where do you find those? Right in the pharmacy, next to the condoms and next to things like that. Water-soluble, water-based, no Vaseline-based. That's very important because it can damage the pump. And don't be shy with it. You will figure out how much is too much. I have patients who like not quite so much, and I have patients who like a very generous amount. In general, I think a good generous amount can be very helpful. Did you say the same?
I do. And I usually tell the men to place the lubricant on the head of their penis and on the shaft of their penis and rub it all along there, so that when the penis starts to get larger inside the cylinder, sometimes if you don't have that, it like curls under, and then the skin on the penis is actually rubbing on dry plastic, and that's very uncomfortable.
So this is my finger, of course, but you rub it across the, especially the tip of the penis and along the shaft. You can coat with lubricant. You can work that on the penis. Then you're also going to lubricate inside here, inside the tube. So you slip and slide in there rather than stick in there. So you're going to lubricate your penis well, and you're going to lubricate the tube area where it goes in. So you have lubricant both places, and you kind of slip and slide in there.
And I also put like a big dollop of, can you just show her what I'm talking? A big dollop of the lubricant right there, and I tell them to place their penis on that dollop.
That's great.
So that it also slides down easily.
I know this is crazy, but you're learning this, and this does seem crazy. I know you're thinking this vacuum pump, but think about it. If this is dry, the skin is going to you're going to kind of do this instead of slip right in there. So she's saying put a dollop there and you'll slide right in. Lubricate your penis, put some lubricant here and slide right in. Or lubricate the whole canal and you'll slide right in. We'll show you more. It's great because when you lubricate your penis, you and your partner, you can get yourself started with a partial erection. And we're going to talk about how important that is too. Let's go back to the slides for a minute. And so start with a partial erection. Don't put a flaccid penis inside this tube to begin with when you get partial erections. If you get fullness, if you get heaviness, so that's like a 10 or 20 or 30%, or slight hardness of 40%, or harder of 50 or 60%, you're almost halfway there. The blood is already across your penis down to the head, and it's going to receive blood across your penis even better because it's already started. So some of my men are able to get a 10%, which they're like, I know it's not much, but it still helps. Or 30%, full, almost like it wants to get hard, but not even a little hard. Or 40%, a little hard, 50, a little harder, 60, almost hard enough for penetration, 70, just hard enough for penetration, 80, even harder, 90, and so on. But if you can start with a 10, 20, 30, anything, that is like a jump start, and you will be amazed what that will do.
Mm-hmm. And even if they don't get erections, I'll always suggest that they take the tip of the penis and stretch it out a couple of times just to get some additional length in there. It seems like that helps too.
Definitely. But if you can start with anything, and that's where pills come in important. You think, well, gosh, the pill doesn't really work, but does the pill help at all? If the pill gets you up to 30, 40, 50% and no pill, you're at 10 or 0, now you've got this starting point that if the pill helps you in that way and you don't have problematic side effects, you can start with that much and it's going to come up that much easier inside the device. The more you start with, the better. Now, when you take your oral agent, remember, when you take something like tadalafil, Cialis, or sildenafil, Viagra, or vardenafil, there's no trade name for that one anymore, but you take any of them, they're going to start getting in 30 minutes, but they're going to peak between an hour to 2 hours. So take it an hour at least before you use your vacuum pump to get you started and hard. So take it before you do the vacuum pump an hour ahead or 2 so that you're already at your prime with how hard you can get from the pill. And now you can put it in there that hard and bring it up that much easier. I found my patients really like using a combination. If they use the pill and it helps even a little, they like to use it along with the vacuum pump. If you hate the pill or you have side effects that are problematic from the pill, you don't need the pill to use the vacuum pump, but you can use them in combination. Remember to take it about an hour or 2 ahead.
And remember that, Viagra has to be taken on an empty stomach. So you have to account for the 3 to 4 hours of that too. And then the plus side of Cialis, the 20 milligram dose has a effective duration of up to 72 hours. So
36.
I'm sorry, 36. I'm sorry.
But remember, both of them peak in about an hour or 2, and their best effect is about an hour to 3 or 4 hours later.
Yeah.
And sildenafil, Viagra does have to be taken on an empty stomach, so an hour before or 2 hours after a meal, but not right with a heavy meal because it won't absorb the same. Tadalafil, you don't have to be so particular with because you can do that one with food. So don't be afraid to do that one with a little bit of food, but not heavy meals, especially with sildenafil, Viagra, and take it at least an hour or 2 ahead of time, or however long you take it that you get the best effect. Take it that far ahead so you can use it along with your vacuum pump if you want. If you're hard enough to start with, let's say you're already hard and you like, well, but then when I go to have sex, I lose it. Now I'll show you. You just slip your penis in here. You have your ring on the edge, and I'll show you how you just put the ring on. You don't even need to pump. If you're already hard enough, just put the ring on to help you maintain if that's a concern for you. If you're hard enough and you're not worried about losing it during sex, there's nothing to do. Just have sex and enjoy yourself. But if you're hard and you're worried about losing it, you could also use the ring from the device to help hold you while you're having sex. And we'll show you all that in just a minute. So we talked about getting everything trimmed and ready. We talked about lubricating and getting yourself as hard as you can before you put yourself into the device. These are really, really important things that really are keys to success with this device. And I think they hopefully will help you. So then the proper pumping technique. Well, first off, let's go over to this and let me show you how to put a device, for example, together. All right, so let's zoom in on the picture. And here, there's a gasket right here. So if you try to push straight in, it's going to be harder to do than if you push and twist and it'll go right in because of the gasket where these two come together. So that gasket is what makes it a lot easier to push and twist. Whether you have a manual or you have a battery operated, they have a gasket and you got to push and twist. And now it becomes one piece. The manual one will come off this way and it'll have a button on the bottom side of it and a release button on the end or opposite. 2 buttons on there, one to cause the suction, one to release the suction. The manual one, this is just one. Sometimes they pump like this. Sometimes they pump like this one does. But either way, you pump it. You can do it with one hand. You pump, and this is against your body, and you pump. So you pump this way. You can put your thumb here and pump like this. You can hold it upright and pump like this. But you find a comfortable position and you can pump with one hand, and then this is up against your body. So up against your body, and you're pumping with the other hand, okay? So that's how you would pump. The release button is right.
It's different on every product.
Every device is a little different.
Yeah.
But on this device, that's the release button right here. That's the button. So when you push this button, that button is going to release the suction. So that is the release button on the end there. So you have a release button and you have the pump. When you have a battery operated, you'll have a button that you press to cause the suction and then release and hold it to let it move down to the tip of your penis. And then you'll have, but if you want to completely release the suction, you're going to push that button that's on the end or wherever it is on your device. Sometimes it'll be a colored button, but push that button to release the suction and then pull it away from your body, and that will break the suction completely. If you push the button, it'll release 90%. If you pull it away from your body, it'll release the remaining, and it'll completely release from your body. And I'll show you that in a minute. I'm going to try to show you as best I can. It's easier in the office because I can kind of demonstrate and stand and show you. I'm going to do my best to do it on this video, but we'll see how that goes. Okay, go back to the slides and let's move on. So every time you give a couple pumps, we talked about earlier, every time you give a couple pumps, wait 5 counts. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000. Every time you give a couple pumps, wait 5 counts. Every time you push the button for 2 or 3 seconds, wait 5 counts between. Push again for 2 to 3 seconds, wait 5 counts. The reason is you're trying to let the blood move across the penis down to the tip of the penis instead of just the base. You want it to move across down to the head. And if you rush it, it will fatten up at the base, just like Kathy was talking about earlier. So,
and that's sometimes when I find my patients give it up. They go, no, it hurts too much. It's not working. And they throw it in their bottom drawer. So that's where we like to suggest that you go back to your practitioner and you ask them for more assistance. And then don't forget that each of the devices comes with handwritten instructions. It comes with a video. So there's a lot of sources where you can go online and find out the best way to do it if you can't figure it out.
And every time it hurts. This is not a pain for gain. Every time it hurts, you're going to release, you're going to push that release and pull it away from your body and break the suction. And you may do that 10 times, 20 times, 30 times. Doesn't matter how every time it hurts, release and readjust it in there. If it's getting fat at the base, you got to release and readjust it. If it's doing anything unusual in there, release and readjust it. Remember, no pain for gain. Every time it hurts, release and readjust it accordingly. But remember, if you're pushing on the manual, it's going to go bzzz for 3 seconds, and then you're going to release that, still holding the suction, but not creating more suction for 5 seconds. Bzzz for 3 seconds, release for 5 seconds. When you're using this one, you're going to pump, then you're going to hold 5 seconds to let it move across. You're going to pump, you're going to hold 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000. It's hurting. Push the release button and pull it away from your body and release and readjust it.
Okay. And I think the more that you use it, that pain ends up going away because your penis is getting used to being stretched out again. Because it may have been years since you've had a good erection.
Or that much blood in your penis.
Exactly.
So that's the proper pumping technique. Common issues to avoid: ensure only the penis is in the cylinder. You don't want any scrotal tissue or anything else in there. So you do want to make sure that nothing else is being pulled up in there. So make sure you're doing that properly. And so don't forget, that is really, really important. If the penis thickens at the base, what do? Release and reposition.
And remember, patience.
Patience, patience, patience. Do not over pump. If it's hurting or anything strange is going on in there, your penis looks strange or anything, release and readjust it. If you feel pain, if it's getting fat at the base, if it's doing anything unusual, release and readjust it. Always err on the side of safety. Okay, so that's how you pump. Now you've learned, and so you practice that every single day till you perfect a painless, even lifted off erection. So you got this against your body, and you perfect getting a painless, even lifted off erection. It doesn't hurt. It's even across it. and it's lifted off. That's your only goal. Once you've done that and you're like, and so when you're practicing, once you get a painless, even lift off erection, you're going to just let it sit in the cylinder for about a minute or two. And then after the minute or two, you're going to take it all the way out. It's not even going to go all the way down. Put it right back in and work it up again till you get another painless, even lift off erection. Hold it for 1 to 2 minutes, take it all the way out, put it back in. Bring it back up again till you get a painless, even lifted off erection. Hold it for 1 or 2 minutes, take it out, put it back in. We have people do 5 to 10 penis push-ups, holding them each a minute or two, painless, even and lifted off till you're like, got it, mastered it, know how to do it perfectly. Now you're ready for the rings, and not until you've done all that. So when you practice every day and you've gotten comfortable with that part of getting a painless, even lifted off erection, now you're ready for rings.
And everybody has different time frames. Some patients get to that point, they've got partially good erections, they may be able to add the rings within a week or two. I have some patients that they have to just keep practicing for 3 weeks before they're brave enough to start with the rings. So again, you're not in any rush. Just learn it and be comfortable with it, and don't push yourself too hard.
And everyone's different. Some people start with a 30-40% erection, so they're already halfway there, and it's much easier to bring it up the rest of the way. Some people start with nothing. I've had people that within a day or two were able to master it. I've had people who it took a couple weeks. There's nothing wrong. Whatever it takes you, that's all that matters. Rings. So preload the ring, and I'm going to show you that in a minute, but we're going to do different rings. And after you achieve a full erection, I'll show you how to slide the ring off. So I'm going to do a couple demo things right now, and then never wear the ring more than 30 minutes. Don't fall asleep with it on. So that's this slide. We're going to move the slide away. I'm going to try to show you a few things. We'll see how this goes.
You want to tell them why you don't leave it on for more than 30 minutes?
Go ahead.
Well, if you leave it on more than 30 minutes, the blood can coagulate, and then that can ruin your chances for getting a good erections again. So really important, 30 minutes and it comes off.
Because remember, your blood needs to exchange blood and oxygen back and forth from your penis. And these rings are restricting the blood flow back and forth like a tourniquet. You wouldn't leave a tourniquet on for a long time either. You don't want to do that. It can be dangerous. So you want to take it off after 30 minutes max, or when you're finished. If that's sooner, take it off. But don't leave it on more than 30 minutes. Don't fall asleep with it on. Rings, there's all kinds of different ones. Start with the biggest one in your kit. And that ring, you can see these are to get it on and off. But the ring, your penis goes in here. That ring's going to go preloaded onto the device. So what you're going to do to put the ring on the device, there's a cone usually in your kit. If there's not, I'll show you how to stretch it across. But there's a cone. You're going to lubricate that cone with plenty of lubricant.
You want to do it now?
No, I'm not going to put real lubricant.
Okay.
I'm just going to show. So you lubricate it real good on here, because the ring's going to grab the lubricant as it goes on, and the lubricant will already be under it, which is wonderful. So you're going to do it like this, and then after you lubricate it, you're going to pull it across that lubricated cone onto here like that. And now the ring is on the edge of the device. So you can see the ring is on, let me see if I can get it on there, the edge of the device. See it on there? Okay, so you can also stretch it on, but now you would lubricate underneath where the ring goes, and you could stretch it across the end of the device like that so that it goes on like this. Here's what it looks like. It's on the end of the device. You've got it. Okay, there's lubricant underneath it. So either use the cone with lubricant and slip it across. With this device, there's all kinds of great devices out there. I've worked with this one from Encore. I've worked with Post-Evac. I've worked with Erectile. I've worked with Augusta Medical. I've worked with many, many different wonderful medical grade devices. This one has a little thing on here, and people always get confused, but all it does is when you twist this, it's going to push the ring off the tip. I'll show you what I mean. You put this on before you put the ring on. If you have one of these little outer things, it just pushes the ring off onto you, but you can use your fingers to do the same thing. If you want to put it on there first, put the cone on, pull the ring across. When you pull the ring across, it's going to land on there like this. Take the cone out, of course, and it's on there. But now when you twist this thing, it's going to make the ring just flew off. It's going to fly onto you rather than across the room, okay? So that ring's going to go off the device onto your penis, okay?
And you want to make sure that you get the ring as far down the shaft of the penis as you can. It should be right up against your body.
And so I'm just going to show you a little bit. Pretend like this is down there where it's supposed to be. But what's going to happen is as I twist this thing, it's going to push that ring off the device. And look, it's on my tie. Now it'll be on your penis, not on your tie, but it's going to push it off the edge of the device onto you. If you don't want to use this little extra sheath, you don't need to. Do just like we showed you before. Get the ring on the device with the cone or stretch it across like I showed you. And now, instead of using that thing, you take 2 fingers like this on each side, 2 fingers or a finger and a thumb, and you push the ring off the device onto your penis, and it'll come off and go on you.
These rings are older rings, so they slide off easier. I want you to understand that when you get your new device, the rings are much tighter. So you may have to Jeff made it look so simple, like, just push off. Sometimes it can be pretty hard, but just understand that's going to get better.
And this is going to be this will be firmly against your body with your penis inside. But when you put a finger on each side and push it off, it just flew across the room like it did with the other thing. Because what I'm showing you is, it's on right here. But anyway, what I'm showing you is that ring is going to pop off the device onto you and break the suction simultaneously. And that's exactly what you want. So watch. When you see it this way, watch this on my finger. Here's my finger. That would be your penis. You're pushing it off onto there. And now look. Now I can get the penis out. This is my finger. The penis out with the ring on it. I can get it out of there, and you can use that penis for penetrative intercourse with a partner. Okay? The ring's on your penis now. This is on my finger, but it's on your penis. Start with the loosest one because it's going to feel strange, and plenty of lubricant on your penis and on the device so the ring slips off the device onto your penis. Okay, now it's on your penis, right? Great. You're done. However long that takes, or 30 minutes, it's time to take it off. Now, what are these rings for? So you're going to pull on those rings. Kathy, can you kind of show how you pull on each side of the rings?
They're going to come like this and gently pull.
Pull.
And it'll slide right off.
So remember, your penis is well lubricated. And so when you pull on each side, you're releasing the tension. So your penis in the middle will start dropping. As it starts to drop and the lubricant's on there, you're going to inch this off your penis and wash it with soap and water.
And what he means when he says dropping, the blood is leaving the penis. So after you first start to pull it apart a little bit, it gets smaller right away.
Your penis is going flaccid. And as it goes flaccid with plenty of lubricant, you're going to inch this off the tip of your penis and you can wash it with soap and water and reuse it. Remember, it's hard to tell here, but see how much bigger this, hopefully you can see, one ring is than the other. They're different sizes. Okay. So, and there's chunkier rings. This one is a thinner ring. Some people like. This is a fatter ring, but there's all different rings. And so you need to find the ring that you like. And there's several different ones out there. So remember, never wear that more than 30 minutes. Don't fall asleep with it on. When you take it off, you stretch first and then plenty of lubricant on your penis. You inch it off, wash it with soap and water. Okay, that's the ring.
Do you want to tell them that you can use it more than once in a day? That's the beauty of this product. If you put the ring on, you leave it on for 30 minutes, but let's just say it's like an anniversary or you're interested in intercourse longer than 30 minutes. You can just let the blood leave the penis, rest for a second, and then you can do the whole thing all over again. So that can increase some of your spontaneity.
Right.
You know, give it as often as you want.
So you think, well, maybe that morning you had sex, but you could that evening too. You just can't wear it for more than 30 minutes, and you need to give it an hour or so break, but you could have sex a couple times in a day. That's for sure. Let's say you're on a romantic weekend. You could have this intercourse kind of sex using this. Let's say you want to be more spontaneous and don't want to deal with it. Have outer course. You don't have to use this, but it can be helpful if you want to have penetrative sex. Let's go back to the slides for a minute and finish that up. And hopefully this is all making sense. We're trying to make it all as crystal clear as we can because we found these are really helpful things for men. We've talked about the tension ring. I think we've got that covered, Kathy. Let's talk about So we talked about every day you're going to practice 5 to 10 penis push-ups, holding them 1 to 2 minutes inside of the device till you master it completely. Practice. You will get it. And once you get it, patients tell me all the time, I don't practice anything. I could do this in my sleep now. I know exactly how to do it. I had a physician friend who pills stopped working. I'm like, do you think it's cumbersome? He's like, it's great. It works. It allows me. This was around, he had turned around 80 years old and was just like, I can't maintain with the pills anymore. He had done so good to that point. And then we gave him instruction. He got a good device and he's like, I'm thrilled that I'm able to use it. Is it perfect? No. Perfect as you think it's there. Oh God, I wish we could give you that. But it does give us a completely non-invasive way that with practice and patience works in a good 90% of patients. A good 90%. I would say in my patients probably even more than that, and Kathy has found the same thing. It's rare that we can't get it to work. It's physics. It forces more blood in and it traps with the ring. You still may think it's barbaric, and we understand that, and it still may not be right for you. But if you're open to it, we have found that it can be helpful and it does work when you want to have penetrative sex.
And I think the other thing that you might want to realize, when we talk about people with medical conditions like MS or spinal cord injury, what's a good position for you to have to try to use the pump? You can be sitting in a chair and it will be just as effective. I find sometimes if you sit in a chair, it takes a little bit longer to get that erection. Obviously, by standing, you're going to have that natural dependent flow, but be creative about different positions. Some people will lay in bed and allow the partner to be involved in producing the erection too. So
the more upright you can be, the better. If you can prop yourself against a counter or a table even while you're working, because if your legs get too tired, but the more upright, the more things will flow down in. And like Kathy said, you want to kind of put it dependent. Here's your body and kind of dependent, get your penis in there. But you want the scrotum out of the way.
Mm-hmm.
So that can be really important, positioning as well. Consistency is the key, and practice and working with the device. It really is the key. Well, we're not trying to sell you on this device at all. We're just trying to tell you there is a non-invasive treatment that works in a good 90% of men with great practice and patience, and there's good and bad with everything. So this is something that may help you.
It's a wonderful product, and I think some people are a little terrified to use it, but it really is going to enhance your sexual life. Just be open to it and don't be afraid to ask a lot of questions. Bring it into the practitioners that you work with and ask for help. Have them help you.
They can work with you one-on-one with your device to make sure. And almost always I find they weren't doing enough releases. They weren't going slow enough. They weren't using enough lubricant. Those are the common things. But we usually, when we work with them, we can figure it out, and it does work. So it may not be perfect, but it really does work, and you can involve your partner with it. So you may want to have it preloaded with the ring in the bathroom, ready to roll, or next to the bed, and that's fine. Your partner may want to, I'll put the ring on, then you. One of my patients said, oh yeah, she said, I'm like Arnold. She says, pump me up. Whatever works for you and your partner, honestly. And if your partner doesn't want to be involved in that part of it, you can have it preloaded with the ring and ready to go with the lubricant and everything. You really can make it work. But I'm not saying it's for everybody on the face of the earth, but it really is a device that we've seen, it can be life-changing for some men. Mm-hmm. Is it perfect? No. But it's physics. It forces blood in there and it traps it with the ring, and it works for most men.
And there's a subset of men that don't intend to have intercourse at all ever again, but they still want to know that the penis works, and this can accomplish that task. They'll just practice with it, get the erection, and just kind of let it stay there a while, and they just like to know that it works.
And sometimes they'll never even use a ring in their life. They just like to get it erect in the device, let it sit in there a few minutes, and release it, and that's okay too. Mm-hmm. A lot of information. Hopefully it's been helpful. I'm not sure if we have questions. We'll look for those if there's anything, Vic.
Hey, Jeff, that was really good. I haven't seen any questions coming in, but I thought I'd add a little bit to your discussion, some of the things that I've noticed too with teaching patients how to use this device.
Awesome.
Sucking in the scrotum can be a huge problem with the pressure pulling it in. And some of the tips that I found, and I don't think you showed this on your device, but they usually have a reducing ring that can be put into the end that goes over the penis to kind of, if you have a smaller penis, to prevent the scrotum from getting pulled in. I've had guys just kind of tuck and pull down on the scrotal skin as they're pumping to keep it from being pulled in.
So Vic's talking about a ring. It looks like a little cover that goes over the end with the penis hole in the middle. And so it covers the area around the penis and the holes in the middle of it. So there are those special rings that actually cover the whole device, and then the penis goes through the hole in the middle. So that's a different kind of ring that may work for you in particular.
And, you know, I agree with you as far as the scrotum being pulled up, Vic. I'll actually have them when they're learning it in the beginning to take their fingers like this, kind of put them down there in the scrotal sac and make sure that the testicle or the scrotal tissue itself is not pulling up. And then I'll usually have them adjust it. That's why I like it in the dependent position, because it keeps pressure at the bottom part of the cylinder as well as the top.
So underneath the device, you're pushing the skin and scrotum down away from the device. So she's saying push downward on the scrotum and stuff. So if this were me, then I would be pushing down on myself on the scrotum underneath the device. Great.
And then usually you figure it out. Okay, so if I do it like this, I better change how I'm doing it. And they don't have to do that the rest of their time.
Vic has worked with many patients with the device too. Those are great tips. Other tips, Vic?
Yeah, Jeff, the other thing I wanted to have you address is somebody who takes blood thinners or daily aspirin because of the suction. I have had patients, especially like people that take daily aspirin, get little petechiae, little bleeding under the skin. Can you maybe address that?
So side effects can be swelling, bruising. Petechiae are little specks like bruising type things. But yes, that can happen. If you take any blood thinner, you're going to want to be even more careful and cautious with how you pump and giving time in between and making sure you're not aggressively over pumping the penis, for sure. And every single time it hurts, you're going to release and readjust. If it's pulling somewhere, because the pulling can catch skin and cause the petechiae or the bruising. So again, always release and readjust. Pull the scrotal or the tissue out that's pulling in. Make sure you do all that. And then if you're having a lot of trouble, it's really, even before you're having a lot of trouble, it's time to call, because they can bring in a specialist from the company, or like us, we do it ourselves. I work with the patients directly with the device to show them how to use it. They may have a nurse in the clinic, someone from the company to come to the office, or an advanced practice nurse or a physician assistant to help you with your device and the lubricant and everything in the office.
Yeah, absolutely. I like the device that you were demonstrating. It's one of my favorites to get patients, because I think that one of the problems when your hands are all full of lube, you got this whole thing lubed up, everything's lubed, and then you try to push that band off and you're sliding all over the place. That little twist thing is really, really good.
It really is effective, isn't it?
Yeah.
It's so simple, and people will be like, they think this is a hole. This just makes the thing twist. And all it does is when you twist it, you can see it just goes to the edge to push the ring right off of the end. So it is a good device, and it's not a really expensive device. What should you expect to pay? One year, one of the devices, I think it was the Post-Evac, was like $30 on special or around Christmas on Amazon. But most of the
Christmas,
it was crazy. I'm like, get that in your stocking, right? But you can get a good medical grade device certainly for around $100, sometimes $80, sometimes $150. Sometimes you can pay hundreds of dollars. There are some devices that the pump power is a little stronger and they are a little more expensive. It just depends. You got to see what works for you. I just hate for people to invest like $300 or $400 in their very first device. They need to figure out it's going to work for them and they're happy. And there's no reason, A lot of the devices are $99 and free shipping from different places and stuff. So,
And it comes in very discreet packaging. That's important to know too. So you're not going to be advertising to the world what this is.
and you don't have to have a prescription for many of these devices these days because they've been
Right.
around for a while. Careful, safe work, and nothing replaces working one-on-one with a healthcare professional with all of this. But I think those are some good tips. What else, Vic? Any other tips from you?
Yeah, a good point you made was the make sure it's a medical device designed for doing this, because there are some stuff that is sold in the back of books. I'm not going to say which ones, that are like hooked up to things that I use to get pressure for testing carburetors, suction and stuff, and
No,
you can get too much pressure and really cause damage.
I
Most
have
of these
an
medical ones-
engineer patient who decided to make his own, and he used a vacuum, like
yeah,
a
a
floor
real
vacuum.
vacuum. Yeah.
Mhm.
So be careful too, because sometimes some of the devices may not work properly. I've seen some that have a little lip on the end here, and you can't even push a ring off of it properly.
Right.
So you want a good quality device. But I have seen people come in with devices they got wherever that I said, bring it in, let me look at it at least and make sure. But in general, I think a good, solid medical device, it's been tested for safety and efficacy, and it's been shown to be safe. That's what we recommend. This is Encore. Post-Evac makes a very affordable one. Erectile has some. Look out there and see the different devices and what you think about them. The newer ones, you should be able to do everything with one hand against and you can secure it with your other hand, but one-handed. You shouldn't have a separate pump and all that. It's been streamlined. So get yourself a good device, and any of those are good devices. Anything else, Vic or Kathy?
And I think the one thing I would say is, it's worth your time to come in. If you're having trouble, you order one. It's not working. I always tell patients 5 minutes with me is going to be better than hours of frustration.
For sure. So don't be afraid to call and get help from someone who can show you with your device how to use it. And remember, when you're wanting to penetrate your partner, whether you're a male and a male or whether you're a male and a female, you can use this device and it will work. And so realize that it's for penetrative intercourse sex. When you want to be spontaneous, leave it alone and have outer course. Anything else, guys, before we do our closing?
No, I think we're good.
So
just want to say thanks to all the ex folks that tuned in today. We were kind of blowing up on Twitter today. So
oh, good. Well, hopefully we're going to get people to learn this
viewers.
device. It's something different, and it can be helpful for the medical condition of erectile dysfunction. And it's called the Vacuum Erection Device, or the Vacuum Constriction Device is the medical equipment. It's been a lot to take in. So I want to do a little bit of a centering exercise. Then we're going to tell you about next week. But for now, I want you to get in a comfortable position like we do at the end of each podcast. I want you to put your feet flat on the floor if you're sitting, or you can lay down and get yourself comfortable. If you want to close your eyes, because we're going to take a few minutes. This has been a lot to take in tonight, and we probably got your blood pressure and pulse up a little, thinking about, oh my gosh, this is a little overwhelming. Center yourself. Stop and breathe. 4 counts in, slow counts. 4 counts out. We're going to try to get that blood pressure down a little. We're going to try and ground you. You're going to take these gentle breaths in. Breathe in, 4 counts. Fill up your lungs and your abdomen. As you exhale, feel yourself release all the tension in your shoulders, in your neck, in your stomach, wherever you're holding tension, and release that tension as you gently exhale for 4 counts. Inhale for 4 counts. And then exhale 4 full counts and release all that anxiety, tension that you may be feeling around all this. Continuing to breathe, 4 counts in and 4 counts out. And as you do that and continue to breathe, I want you to remember this. You are so much more than any health condition that you have in your life, including erectile dysfunction. Erectile dysfunction does not define you, nor does it diminish you or your worth in any way, shape, or form. You are whole. You are worthy, and you are enough, just as you are. These are just things to enhance love play. And if they work for you and you're happy with them, you can incorporate them with your partner. and enjoy them. If they make you crazy, you do not need to ever touch them, buy them, or use them if you don't want to. We just want to bring this information in to you to help you in the future. Vic, what's going on next week?
Well, here we have next week.
Most women experience symptoms of menopause, including vaginal dryness, which can be debilitating and deeply impact their quality of life. On top of that, many women struggle with disruptive hot flashes. In this episode of Dr. Jeff Talks About Sex and Intimacy, Dr. Jeff is joined by women's health expert Dr. Margaret Amy Hull, a nurse practitioner specializing in menopause care. Dr. Hull will break these symptoms and discuss a range of treatment options to help women find relief and regain comfort and confidence. This episode offers vital insights and support for navigating post-menopause vaginal dryness and hot flashes. Join us next week to learn more.
So one thing you didn't mention, Jeff, is that you didn't tell everybody where you're broadcasting from. This is a remote.
Yeah, Kathy and I are remote, and my wife's back there on another call on the balcony, but she's on the balcony because we're in Puerto Rico and it's like 80 degrees. So it is quite wonderful. I know we really wanted to give very practical information tonight, and you got actually 3 experts who have worked with thousands of patients. And I hope that this information helps you if you want to use the vacuum device to be successful with you. Thank you so much for joining us this evening, and good night.
Good night.